My name is Leanne Dow. I have began working for the NHS 14 years ago in the acute setting. I began working as a technical instructor in the stroke unit and the care of the elderly wards, and then laterally the last 5 years I've worked as a Band 4 rehab assistant practitioner. I rehabilitate patients after intensive care, working across all 4 therapies: physiotherapy, occupational therapy, dietetics and speech and language therapy, working across multiple different teams. And this first started off as a research project, and it proved to be a little bit difficult in the transition from the research project into integrating into the therapy teams, but we're starting to do that now, and it's working out really well. This course was first brought to my attention at our Lothian-based peer support group meetings. I felt doing the course would help professionally and personally, and moving forward in our team we hope to employ more Band 4 assistant practitioners, and I thought that doing this course would help me in a mentoring role for these new members of staff. Because my role is a multi-therapy role, I work across multiple therapies and multiple ward areas, so I quickly need to integrate with these teams to help work with the patient. It's also a standalone post. I'm the only Band 4 doing this post, and it can seem like quite an isolated role with no one else having the same common goals as me. Yes, definitely. I'm 3 months into the course already, and I'm seeing the need for good communication, both to help with the patient's journey and to help me integrate into different teams across the whole hospital. I think the course will give a better understanding of the role and remit of the Band 4 position, and will help develop the role further. And for example, we hope to develop the occupational therapy side of my role. It will also provide me with the leadership, quality improvement skills and the mentoring skills that will be useful with any new members of the team coming on board. Yeah, the lecturers have been a great support. They've been emailing us regularly, they're giving us prompt feedback on our assignments, and they're encouraging us to get in touch and point out to them if there is any difficulties with us either submitting work, or if we're not understanding a piece of work we're about to submit. We can contact them both by email or on the phone, and we've seen them for 2 study days so far, so they have been very supportive. Well, my caseload manager is actually my mentor, and because she has a great understanding of my role, that's really helped us in the process so far during the course. We're meeting up regularly each week to discuss my coursework, and I'm emailing things to her in between times for her feedback, so she's been a great support to me. Well, we're 3 months into the course now, so we're just in the initial stages. But I'm finding that good communication is definitely helping the patient understand their journey better. At the moment, overall, I'm learning about personality types, how team works, and different personalities fit into that team, and I think that is definitely benefiting me, integrating into different teams now. I look forward to staying with the team that I'm currently working with, and seeing how the role progresses. We hope for more generic assistant practitioners to be employed, and I hope to take on a mentoring role with these new staff members. Well, in terms of a distance learning course and allocating a mentor within the workplace, I'd advise to choose someone who you work well with, who understands your role, and also someone who has the time to support you. I'd advise to plan ahead and have allocated study days, and read ahead in the reading list, and source your library books well in advance of the submissions for the assignments. Seek advice or support from the lecturers and advise them if you're having any difficulties. And really just don't leave things to the last minute. plan ahead.